Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Hello again.
So, Dr. Mencia.
Since we didn't even get to the main course yet.
No, and I was thinking about that because one thing, when I think of food, I think of eating, and I think of people who can't eat because their teeth aren't working. So let's talk about dietitians, and that's another problem. They come in, they're not eating properly. They can't eat any crunchy salads because their teeth aren't working.
Exactly, and a lot of times, people need to look at the mouth because digestion starts with mastication. And if you don't have your teeth on and you are trying to eat because you're still able to swallow, which a lot of people, are so stubborn, they say, I'm just going to take my denture off and I'm going to chew the food and then I'm just going to swallow it. And the problem with that is that food will not be digested. It's more of a psychological thing that you're doing to yourself than a nutritional thing that you're doing to yourself. Because let's say you take a piece of meat and you don't chew it, just swallow it. A piece of meat, swallow it. And then start watching when you poop. You're going to poop that piece of meat. And if you take it and clean it up and look for all the nutrients, all the protein, everything's still there. The acidity in your stomach, all the digestive enzyme that we have, they are not that strong to take a piece of meat and break it down into its component that your body wants out of that meat. Or you take a piece of lettuce, or you take a piece of tomato, you take an olive, and you just swallow it. You swallow a piece of tomato, you're going to poop a piece of tomato. So you need to chew your food. And a lot of times you have patients that they only have their front teeth and they have no teeth on the side. Or they are missing one quadrant, which is one portion, let's say one quadrant on the right upper and one quadrant on the left lower. So when they are chewing, in reality, you need teeth on top and bottom. It's like a scissor. You're trying to break a piece of paper with a scissor. Let me give you one side of the scissor. And, you're going to have to either pull like a knife or do something else. It cannot work. A scissor won't work like a scissor. So you need your teeth. Your teeth are extremely important. And that, when I open my geriatric center, I say I have to have a dental department. Because to do proper medicine, I work very closely. Geriatrician, we work very closely with the dentists in the community. And I remember when I opened my practice, I didn't have a dental department. I couldn't afford that. It's expensive to put a dental chair and all the equipment they have and the water supply and what have you. It was really crazy. And I said, okay, I have to wait and just rent a small office until I can get to the level that I can open a center. So in the meantime, I still have to take care of my patients. So I send my patient to this dentist in Wilton Manors, and the dentist called me. And he said, hi, Dr. Mencia, you new in the area? I said, yes, I'm a geriatrician. Thank you for seeing Mrs. So-and-so. And he goes, no, I'm calling you. I didn't see her. I sent her back home because I don't see elderly patient, and she's on a wheelchair.
Oh, no.
I say, excuse me?
Oh, no.
He said, no, I don't see people in a wheelchair because my office, but he said, I want you to come by my office. It's very beautiful, sophisticated. So when you have, and I went to the office, I wanted to see it because I said, I'm going to build my office and I'm going to make it beautiful, sophisticated, and then put my elderly patient to sit on it.
Is this common? Is this common? I was just thinking about what you said.
I have no idea. That happened to me with one person, one dentist, and he, to this day, have motivated me to move much faster in opening my geriatric center when I first came here.
But wait. I want to push on this one. So when you think of it, if a person is in a wheelchair, they're not going to, your equipment, or generally the equipment, will not work on it. So what do you do?
Well, I built my dental operatory wide enough that a person in a wheelchair can come across, and then they can be transferred into the regular dental chair and be seen there. And the dental chair will accommodate for a wheelchair. So the arm will lift, we can lift the person up. And sometimes when they come just for adjustment, let's say if they have their denture, or we are doing mini implants, or we're doing, regular implants, and they need adjustment, they come in the wheelchair and we work from the wheelchair.
That's
they are comfortable
beautiful.
there.
See, it's interesting. I never thought of that until you just said this.
Mm-hmm.
So we love that guy, whoever he is.
I
Motivated
don't hate
you.
him. I love him so much because
Yes.
he motivated me to go on and do something this wonderful.
But you see, as a geriatric physician, you understand that. When you think about it, how many people listening to us right now are in wheelchairs, and they say, I can't go to the dentist. What dentist is going to take me?
Right.
But you would go to Dr. Mencia's office, the AGI Medical Center, and not only would you have someone there.
We will accommodate, but we will treat you with dignity.
Yeah, exactly.
And and then this
that's
is
right.
one of my patients. His daughter is a doctor, and he said, Dr. Mencia, when I came here, and she's a doctor. She's an internist like me. She said, when I came here, how do I take care of my father? So I was thinking about a mobile dental to come to the house, but he's not homebound. But so she will have to pay out of pocket, and the father have insurance, and she didn't know how to handle it until she met us. And then the father has dementia, so he will scream and get mad and get confused, and we can handle that.
That's a beautiful story.
We have patients. We saw one patient that came in, was a new patient this week, and Dr. Massey, one of the dentists, was going to see the patient, and the patient is on a blood thinner, and she has a toothache, and we needed to do an extraction. That tooth needed to come out. So it was a very interesting case. She just got a liver transplant. She's on a blood thinner. We have to pull out that tooth. So he called me and he said, I need your advice. How do we handle this? I said, okay, Dr. Massey, let me take a peek at the lady. We brought one of the nurses. We checked the Coumadin level. The level wasn't that high, so that was good enough. I took a look at the picture on the tooth. Now, I'm not a dentist, but I'm an internist. I used to teach anatomy. So I look at the tooth, and it was a straightforward shot. I see the tooth is not crooked. It's going to be an easy extraction. I say, okay, go ahead. Give the local anesthetic and put the patient on amoxicillin for a week after the extraction, regardless of how clean it is, and you're going to be okay. But he was concerned because he's dealing with a patient with a liver transplant. He's scared. He said, I don't know. I just want to make sure we are doing no harm here. And between him and I, we were able to manage this beautiful lady and do the extraction, and then, bring her back to do a bridge for her. So she was taken care of.
See, but the fact you were there also, making sure that, how's she doing, and then following up on her. But something that we were talking about before, the fact that she now goes to a dentist. Now you can be seeing what else she's doing, because liver transplants, we know that then
all of those patients, they are afraid to go to a
tough.
dentist. They don't want to do because, I have kidney transplant, or I have liver transplant, or, I don't want to go to the dentist because I have diabetes. It's the opposite. It's the other way around. You need to go to get your cleaning done. We have, excellent hygienists that work with us, and, they work 6 days a week. They're all, they are with me 6 days a week at the office, and the dentists are there 6 days a week. And, the dental department, my poor, humble little dental department have grown now to a
Beautiful.
multi-specialty.
What you've done to it.
A multi-specialty that we go from cleaning through the hygienist all the way to implants, So we have, just like in the medical department, that we have the dermatologists and the ophthalmologists and the podiatrists. We all work in conjunction, the pain management doctor, we all work in conjunction with each other to do the best care possible for that patient and to create communication, because that's one of the things that is lacking in healthcare. You hear Hillary and Dano, communication.
Yes.
So communication is lacking in this country when it comes to healthcare. And that's why lawyers have fun, having lawsuits left and right. Because you have the podiatry with let's say the person with the ingrowing nail. You have the podiatry will go and take care of the ingrowing nail, but that foot is attached to a human body. So is there a problem with circulation? Is there a problem with diabetes? What's going on with this patient that you get in the ingrowing nail? Is it just that you just wear tight shoes and you got an ingrowing nail? We don't know. But it could be something simple as the wrong shoes. But it could be something really complicated, like that patient that came in as a new patient to me just to take care of the ingrowing nail, and it was uncontrolled diabetes and peripheral vascular disease. That was horrible.
When I first met you, though, what you really said, which never left me, was if you have someone there, they don't have to now make an appointment to go to a podiatrist. Now they have to find someone that will take them, make the appointment, or they don't have to go to someone who is a dentist. That it's all there. And that was what you loved, wasn't it? That
exactly.
As a geriatric physician, you understood how difficult it is for an older person, if they don't have a family member, to try to get someone to make those arrangements.
And it's like when you come to my center, one of my centers is going to a restaurant. It's an open menu. I have patients that have come to me and they say, oh, but I love my dentist. I've been with my dentist for 20 years. Keep your dentist. Oh, I love my podiatrist. He's really good. Keep your podiatrist. If you are happy, if you are having a hard time, go in town from corner to corner, in your county, trying to get care. Your cardiologist is across county, and you have to go to Cleveland Clinic to do this, and you have to go to Miami to do the other thing. We integrate all of that. But I have some of my patients. James, he loves Miami. I have one of my patients. It's like 8 foot tall. And he loves Miami. All of his care is in Miami. I say, that's fine. My skin, no, I don't want the dermatologist here. I want to go to Miami. I want to go University of Miami. I say, okay, James, go to University of Miami. Go and get taken care of. And the guy has a walker, but he loves getting on a bus and going all the way down to Miami. I say, amen to that.
Well, maybe he finds chicks on the bus.
Yeah, who knows? Yeah, somebody to talk to for a long drive.
But wait, I just thought of something. You have this building next door. We have Ina. Let her start cooking.
Oh yeah!
Let's have a little international restaurant
cooking
there.
class.
Yeah, cooking class,
we can
restaurant.
Do a cooking class.
Why are we doing that? It's a wonderful thing. You could have people come, and on Monday you serve this, and number 2 you do the second day, Wednesday you do some other kind of food. No.
Yeah, that could
That's
be.
the one thing you're missing is food.
Yeah, that could be the waiting
That's what
room.
you're missing for food.
Number 17.
Right.
The dentist is ready for you.
The dentist is ready for you. But the other thing that when
when you go to the meat market, take a number.
Yeah, that's right. Which fish do you want? You have to go there 3 a.m. to get all the fresh vegetables and the fish and slaughter the animals.
Yeah.
And
all
the
fresh, everything fresh.
Chickens.
Yeah.
But we're having
and the wine.
The wine.
Oh, here we go.
Yeah, we
I'm
always
sorry,
have to go back there.
Russian don't drink wine.
Oh, they don't.
What
Yes,
they
do.
No, vodka.
Oh, vodka. Oh, but they still drink wine.
Vodka and water. And water and vodka. And more vodka. And less water. And then less water. And then some wine sometime when people come.
And beer.
And beer in between.
I'm glad you brought up
beer to rinse your mouth.
Yeah, that's the mouthwash.
But I've heard about red wine. Let's go through this red wine stuff. Red wine, they say, is the healthiest thing for people to be having. But
Not
what
the
if you
healthiest
never?
thing. Not the healthiest thing.
But
it's the healthiest drink.
the healthiest drink.
It's not healthier than other food. So you have food in the drink department. You know, I mean,
Yeah,
you're
let's
talking,
go to
you're
drink
talking
department.
to
Okay.
we have a drink expert over here.
Yeah, now you're
Ina,
talking my
Ina,
language.
let's go in. You see, she's turning red. You know, so that's one of
okay.
the signs when they
Yeah, I
have too
see
much.
that. I see that. You're turning more red than she. Okay, but wait. Let's go to
In the
red
drink
wine.
department, look, there are, you know, you have, for example, liquor. You have beers. You have hard liquid, and you have wines. So, for a diabetic, the liquor is the worst thing because they're very high in calorie.
Full of sugar.
So if you take like Grand Marnier or Amaretto di Sharono, you know, any of those things. They are full
Prosciutto?
what's the Greek one? Ouzo?
Ouzo.
Ouzo.
Full
They
of
are,
sugar.
they are full of sugar. So it's a lot of calorie on those. So if you are a diabetic, you really want to stay away from those things. If you have congestive heart failure or swollen ankles, beers they are not good for you because, you know,
Water.
right, and dehydrate you. Now, if you're gonna drink wine, is good for you because the red wine, it helps with the heart, and they have done study in people in Europe. They usually have wine with their lunch and dinner, and they seems to be healthier than the people that do not drink alcohol. So there's something in the red wine, and they have been able to pinpoint the chemicals that tend to be protective of the heart. So there are some health benefit of
But
red
if
wine
you don't
in
drink,
moderation.
you shouldn't start drinking, right? If you
Exactly. If you don't drink, it's not that you have to drink wine. You can, you know, get this through supplements and natural food. But if you're going to drink alcohol, try to go for something that is beneficial. Like we say about fruits. If you are a diabetic, you don't want to eat a lot of fruits because it's going to increase your sugar. But if you're going to have fruit, then be smart about it. If you have constipation, you want fruit that are rich in fibers. So it helps you with the constipation.
But how about the apple a day keeps you know who away?
No,
Yeah.
that's bad.
You know, yeah,
Stay
right,
away
you
from
don't-
that
you
apple so
wanna-
you come
don't
to my
eat
center.
apples. No, but seriously, an apple is something that does contain wonderful.
But you know something?
What?
I think the saying had been misinterpreted.
Okay.
Yeah, it's like trying to interpret a good book. I think that saying had been misinterpreted because it says a apple, not a dozen of apples. No, a apple, not a dozen of different fruits, bananas, and
You're
what have
right,
you.
you're
And
right.
I think if we overdo it with fruits, if you are diabetic, you're gonna mess that up. So
One
it's the A,
apple, right?
One, just
An
the
apple.
one.
One apple a day, one
Right.
banana a day,
Right.
one. Because it's interesting that we know bananas have potassium.
You know, and a lot of people now, they are turning more borderline diabetic than before. You know, since when? Since the bullet came out. The juicer.
Isn't that
Yeah.
really?
Since that juicer came out.
Because it's too much in one time, isn't it?
instead of putting a lot of vegetable, people are putting a lot of fruits, you know? So they are juicing. And yesterday I have a son and a mother that came to see me because the son was taking that I told his mother that she had to cut down on the fruits. And then I opened the blood test and I showed him. And I said, your mother had become pre-diabetic. He go, oh my God, he felt guilty. I said, it's okay. She has the genes. You probably have the gene. So what you guys need to do is cut down on the amount of fruit you are giving her. Put more vegetable when you are preparing those. And the caregiver, who is a nutritionist, was telling the son to just give her a small amount. He said, no, Mom, you have to drink the whole thing. And she will gobble the whole thing down every day. And, you know, it made her pre-diabetic. So it was an eye-opener for him. You know, he came to the office, you know, very humble, and he sat down and he said, I want you to explain to me what's going on because I'm so confused.
So, right. So, as you said, a little bit's okay, but not a lot.
Exactly.
But now you could have a
A
vegetable
apple.
drink.
Of course.
That's not
vegetable.
going to hurt you at all.
And you can put like beet for
the sugar.
sweet, for the sugar. and that's natural, and that's good for you.
I will tell
But
you
don't
something
put a
funny.
lot.
I'm glad you mentioned that because we're going to talk a little bit about poop. You love to talk
yeah.
about poop.
Oh, I love
when
poop.
when I
It's
have a
like
drink
if
and
poop
I have
come out, I mean, there's no constipation, there's no hemorrhoid,
You should
there's no
walk my dog.
diverticulosis. Ooh.
you should walk my dog because
When you poop, you have less risk of developing cancer.
yeah, that's true.
Yeah, if you have good poop every day, the
Maybe
chance.
that's why I've never had cancer.
That's right, me too.
Oh my God.
I'm so
Yeah,
generous.
see if
I'm-
either sex or poop. It's okay.
I'm so generous in that department.
Right. But wait a minute, I'll tell you the interesting thing. When I have those kinds of vegetables in a drink, I poop red.
Yeah, of course.
The beet
yeah.
it comes right
Yeah.
out. I mean, it's
And when you drink a good red wine, you poop dark.
is that right?
Yeah, you poop dark.
That's
from
the same thing.
Well, when you take the cork out, you see they give you the cork for you to look at it. And if it's a cheap wine, the cork is
White.
unstained by the wine. But if you're gonna think I'm an alcoholic, but if the
I did not
if the
know that.
wine, yeah, it's an old wine that had been sitting there, and it's a really good wine, very heavily concentrated, what have you. When they put that cork, you're gonna see it's dark.
That's why they sniff the cork.
And then you
Is
sniff
that
the
right?
cork, right?
Well, this is always such an interesting subject when we get going with we did the nutrition today, but let's just tell everybody, Dr. Mencia will be at the Cure Symposium this coming next Saturday, and he is going to be bringing a couple of Dr. Shen and then another gentleman. We're going to talk about telemedicine, and this is really up your alley because I know you love technology. This is very
Right,
exciting for you,
right.
isn't it?
Yes. We have to stay up with technology with regard to health. What else can we do to help our patients do things better?
Well, do you ever send patients home with gadgets that
Yes.
tell us about that?
Well, for example, let's back up. My philosophy is that if you have a little chest pain and we think your heart is going out of rhythm, and we sit you in a hospital in a beautiful, comfortable bed with a beautiful nurse coming over, or a handsome guy coming over, muscular, and you are sitting there, and he's monitoring you or she's monitoring you and cleaning you up, and you don't live like this at home. This is not what you do at home. I think a lot of time when we need to monitor the heart or monitor a lot of things that we monitor on people, it's better in their own environment. It's like taking a tiger out of the jungle and put it in a castle and say, let's see how the tiger behaves.
Right.
It's going to behave abnormal. They don't belong there. So we don't belong in a hospital. That's number one thing. We belong at home. So if a person has sleep apnea, and I take you, I tell you myself, if I go out of my bed and I go into a hotel the first night, I can sleep because, it's not my environment. I have to sort of like go into meditation, relax, so I can tell myself, okay, I need to sleep. And then I fall asleep. So if I'm going to do sleep apnea, I'd rather do it at the comfort of your home. If I'm going to do a monitor for your heart, I want to do it at the comfort of your home. Because then you are at home. You're going to wash your clothes on Saturday, clean the house on Sunday, take the dog out every day, sweep the floor. Whatever you do at home, you're going to do it. You just do your routine. Go to the supermarket, buy things, come back, get in the car, scream at people while you are driving. Whatever you do, you're going to do it. And then that's the monitor I want to look at, when you are in your real environment. Right. So I love to do those gadgets that we are able to do all these things from home.
And we're going to learn all about that at our Cure
the symposium
Saturday over at Palm Beach State College in Boca Raton. And we're very excited. Yeah, we'd like you to reserve, please. And the phone number to reserve is 561-864-1101.
And for those patients, I was telling one of our listeners from Boynton, for those patients that say, I want to meet Anita. I want to meet her. I want to see what she looks like. They can come to the symposium.
Oh, yeah, but they want to see you. You're the one they want to see.
You're going to be on the podium with me.
Yeah. But you're going to be there.
And Anita and I, we're going to be dancing a tango.
Oh, okay. I have to wear my red dress. I can see it now. I have to buy one. Dr. Mencia, thank you for doing this morning. And listen, people should be going there for a nutritionist. He has beautiful women who are doing this, and they're so smart. And just call the number 954-489-1345, or go on their website, agifl.com, and please take care of yourself. Dr. Mencia and Ina really makes that possible.
Yes.
Thank you again.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors. AGI Medical and Dental Centers wants you to receive the finest and most personal medical and dental care in South Florida. Founded by geriatric physician Dr. Andy Mencia. They combine comprehensive and diagnostic medicine while providing personalized medical care for each patient. Now in 2 locations, Fort Lauderdale and Boynton Beach. Their medical staff is trained and dedicated to utilize the latest medical cutting-edge technology, along with listening skills to provide their patients with the best medical and dental outcomes. Here's some of their unique services. Second opinions for peace of mind and assurances of outcomes. Dental care by prosthodontists and periodontists, from the simplest oral cleaning to a full implant program. Medical professionals visiting and caring for patients who are homebound. Saturday office hours. Go to their website at agifl.com. Be sure to listen to Dr. Mencia and Anita Finley on The Wonderful World of Wellness each Saturday morning from 7 to 7:30 on WSBR Radio, 740 on your dot. To become a special patient, call AGI Medical and Dental Centers at 954-489-1345 in Fort Lauderdale and 561-270-6494 in Boynton Beach. Medicare and most insurance accept.